Hi, I'm Dr. Betts with the Betts Clinic, and I want to share with you today the best types of treatments for a slip disc, bulging disc, herniated disc, really any type of disc injury in your spine, whether it's in your neck or your low back. There are a lot of good non-surgical treatments available to you today if you know where to look. In our office, one of the most common treatments that we do for a slip disc or a herniated disc is called spinal decompression. And what spinal decompression does is we put you on a table that has a computer, and we tell the table which specific segment that we're going to be treating. So if we're going to be working on L4 or L5 area, which is in the lower back, or if we're going to be working on the neck at most common areas, C5, C6, C6, C7 areas, we're going to program the table to a specific setting based on the area that we're treating. So the next thing we're going to do is we're going to tell the computer how many pounds of pressure it's going to need to pull based off of your weight and how recent your injury is to your back or to your neck. And after we program that information into the computer, we put you on the table. It's about a 15 or 16 minute treatment on the table where the table will decompress and relax off and on several times during that 15-16 minute time period. And what that does is it basically helps to rehydrate the disc. It gets fluid back into the disc and it separates those joints. Now the disc, they act like little spacers between the vertebrae in your spine, and those spacers, they're very important because that allows space for the nerves to exit or to come out of the spine. And they go to every part of your body. And if that space is compromised, that's where patients can have pain that travels down the arm or down the leg, and unfortunately it can become permanent unless it's fixed. So as those discs are treated with the decompression, it's going to open up that space and help to rehydrate the disc, help to rehydrate it with fluid and proper nutrition. In fact, the disc, they're actually some of the most blood-deprived areas of the entire body. There's not a lot of blood vessels that actually go to the disc that allow them to heal. So because of that, one of the few ways the disc can actually heal is through proper movement. And that decompression that happens on a decompression table allows for movement, proper movement, to help rehydrate the disc. Now, we've been doing spinal decompression in our office for more than 10 years. We've seen some amazing results, actually helped a lot of people stay out of surgery, gotten a lot of people back to work that were out of work. Some of them had pain traveling down their legs, just some near miracle cases that we've had with spinal decompression. It's a very safe, conservative option for a lot of our patients before they're faced with surgical options. So someone who's looking for the absolute best type of care for a herniated or bulging disc, they'll look for somewhere that does a very thorough evaluation, someone that can do decompression and can also do other types of therapies in their office. For example, we utilize cold laser in many cases, of course spinal adjustments to help take pressure off the nervous system that way, and then also rehab stretches, rehab exercises. Whatever the patient needs, we want to incorporate those types of therapies into their treatment plan. That's the type of clinic that you would want to go to if you're having a bulging or herniated disc to help get well as fast as possible. We hope that you found this information useful. If you have, please leave us a comment, let us know, and we look forward to hearing from you soon.